if we haven't been to the dentist in a year and a half, what is the most important thing that we should be mindful of going back into the dentist's office? What are the things that you're seeing? I'm sorry, what kinds of things with the neglect that you've been seeing?
So to some of the things that we're being seen is tremendous dental anxiety. Patients have prolonged their much needed dental care for such a long time that little problems that they had pre-COVID because they weren't able to go see their dentist in a timely fashion have kind of festered and become a big problem. We're seeing a lot of dental infections, a lot of swellings and pain and TMJ because of the stress. People are clenching more, they're grinding more because because the pandemic weight. Incidence of sleep apnea has gone up. And unfortunately, one of the consequences of the pandemic and the shutdown and the environment has been that a lot of dentists who were perhaps considering retirement took that opportunity to retire. So some of the dental practices had to kind of close down. We had to relocate our practice to this, well, it was fortunate that we found this beautiful space in Tribeca, Tribeca Smiles, Dr. Solomon's practice. We were able to relocate and kind of merge our practice with his. It looks like an art gallery. It's gorgeous, beautiful, but we're still seeing a lot of gum disease that wasn't managed in timely fashion, just now becoming to the point where unfortunately people are going to lose teeth as a result of it that they shouldn't have. They're going to lose, patients are losing teeth because of root canal infections that they shouldn't have had to if they just had received the care that they needed in a timely fashion. And all this stuff just makes dental anxiety worse. So they're much more phobic today of going to the dentist than they were pre-COVID. So we have to kind of constantly reassure them and show them the extent to which we've gone to make sure that not just our patients, but also our team members and ourselves, we're protected from transmission. And, so it's a trickle down effect, but we're seeing a lot more emergency care, a lot more disease than we did before. Unfortunately,
Okay.
it's just the consequence of not taking care of things in a timely fashion.
All right, Dr. Singh, we got a lot of people that want to ask you questions. I'm going to ask because we don't have a whole lot of time. We rapid fire before I get to the phones. Tanya, do you have anything for Dr. Singh before we go to the phones?
Let's talk about this weight. I put on the COVID 40. The COVID-19, that was by like the end of June. Okay, I don't sleep at all anymore. I sleep about 3 or 4 hours. I sometimes wake up choking. I sleep on a wedge. I don't have acid reflux anymore. I saw that. So what do we do about this?
So, weight management is a key. Excessive amounts of weight has been linked to so many problems, including, adult onset diabetes, high blood pressure, which is a risk factor for
My sugar
heart
is
disease.
good. My
That's
sugar is
awesome. But putting on excessive weight means that there's a lot more weight on the body that's putting pressure on the circulatory system. So of course the blood pressure goes up. And yes, a lot of the weight is distributed unevenly, and a lot of the weight is distributed around the neck and the chest area. And all that weight around the neck just makes the airway, which is the air passage that goes from behind your nose all the way down to your throat, it compresses it. So when the air passage is compressed at night, when our air passage kind of narrows as a normal response to sleeping, now it just collapses. So the incidence of snoring is higher. The incidence of sleep apnea has gone higher. When we put on excessive weight, especially around our chest, something called obesity hypoventilation, that excessive amounts of weight on our chest, especially when we're lying down, puts weight on the lungs. So the lungs don't inflate as much. So when we don't inflate the lungs as much, not as much air is going in. Along with there comes oxygen. That means not enough oxygen is being circulated throughout the body. So we have low oxygen perfusion. And like anything else, the brain wants oxygen, and when the brain doesn't get enough oxygen, bad things happen, so weight management is the key. And the sad part is that it's not that easy because it's a vicious cycle. When we gain weight, our airway collapses, we don't sleep well. And when we don't sleep well, we have something called sleep deprivation. So we don't get good quality sleep and we don't get good quantity of sleep. And that just plays a havoc on our not just our circulatory system, but also on hormones, because there's certain hormones that regulate hunger. And we know for a fact that the two hormones, ghrelin and leptin, that control the hunger and the feeling of fullness, are not managed well, especially in patients who don't get the restful sleep that they should be getting. So in patients with sleep apnea, untreated sleep apnea, these two hormones are not regulated, and that actually causes people to eat at night, especially. And what does the brain carve? The brain kind of craves one thing and one thing only: carbs, because the only food brain can use as nourishment is glucose. It can't sugar. It can't process fats. It doesn't need fats. It doesn't need protein. It only wants and needs sugar, carbohydrates, simple sugars.
You talking to me?
Right. So frenzy eating with on high carbohydrates is what the brain kind of tells the person to do, because the hormones are not working, in harmony. And there's another big hormone that actually controls the weight, along with the thyroid. The thyroid control mechanism is also very, dependent on sleep. So it's like a perfect trifecta. When we don't get enough sleep, when we don't get adequate amounts of sleep, and the restful sleep, the quality of sleep, then all these hormones go out of whack and make us eat more. And the sugar regulating hormones are also not being secreted in the right amount. So we develop something called insulin resistance along with it.
So do I just make myself go to sleep? Do I just go, it is 10 o'clock, you got to go to bed. You may not feel tired, go to bed.
So the other thing is you have to create an environment that kind of promotes sleep. Your body wants to kind of be in an environment that kind of makes it want to go to sleep. So one way to want to go to sleep and need to go to sleep is kind of tire yourself out. So it's called sleep homeostasis. The more you stay awake, the more your body wants to sleep. The more you work, the more adenosine that's left in your body, which is sleep promoting chemical, the more your body wants to sleep. So if you, let's say, you work all day long and try not to take naps during the day, so you are tired at the end of the day.